Most men ignore this small body signal. That is why erection problems slowly get worse without warning. Hi, I'm Dr. Ross. In this video, you will learn why some men are using a soft toothbrush for a nerve stimulation technique, what the science says about it, and the safe way to approach erectile health. If you care about your health and performance, follow this channel. Now here's the part many men never hear about. One common mistake damages confidence fast. Men focus only on the penis, while ignoring the nerves and blood vessels connected to erections. The serious consequence is this. Small erection changes sometimes point to larger circulation or nerve problems developing inside the body. I know the toothbrush idea sounds strange. Most men laugh the first time they hear about it. But there is a reason this conversation started getting attention online. The method focuses on a small area called the perineum. That is the space between the scrotum and the anus. Under that area sits an important nerve pathway linked to erection function. Before you try anything, you need to understand what is happening inside the body first. Without that, men often do the technique incorrectly, use too much pressure, or expect instant miracle results. And that is where problems start. Erections depend on three major things working together: blood flow, nerves, brain signals. If one part struggles, erections often weaken. Many male patients think erections only depend on testosterone. That is not true. A healthy erection starts with the nervous system sending the correct signal. After that, blood vessels open and allow more blood into the penis. One of the nerves involved in this process is called the pudendal nerve. This nerve helps control sensation in the pelvic area. It also supports muscles involved in erection function. The perineum sits close to this nerve pathway. Some researchers studied whether gentle stimulation around this area affects erectile response in certain men. A few studies suggested nerve stimulation and relaxation techniques improved arousal response in some male patients with mild erectile difficulty. That does not mean a toothbrush cures erectile dysfunction. That part matters. Online videos often exaggerate these ideas. They promise instant hardness in seconds. Real medicine does not work like magic tricks. But nerve stimulation and relaxation techniques sometimes influence blood flow and arousal response temporarily in certain men. That is the honest medical explanation. Wait, this is important. Many men create more problems because they panic too early. 1 weak erection after stress, poor sleep, alcohol, anxiety, or fatigue does not always mean serious disease. But repeated changes should never be ignored. Your body usually gives small warnings first. You might notice erections are weaker in the morning. You might notice firmness drops faster during intimacy. Some men notice delayed response during arousal. Others notice reduced sensitivity. At first, many men blame age alone. Age plays a role, but age is rarely the full story. Blood pressure problems, diabetes, poor sleep, smoking, stress, obesity, low activity levels, pelvic tension, medication side effects, and circulation issues all affect erection quality. And many men over 60 deal with several of these at the same time. That is why quick fixes fail so often. A man tries supplements 1 week, strange internet tricks the next week, then panic grows worse when nothing changes. In my clinic, I see this pattern often. The fear becomes stronger than the physical problem itself. Now let's talk about why the toothbrush idea became popular online. The toothbrush creates light vibration. Gentle vibration over certain nerve areas sometimes increases awareness and stimulation around the pelvic floor. That is the theory behind it, but many men completely misunderstand the technique. Some press too hard. Some scrub the area aggressively. Some use electric devices incorrectly. Some continue for several minutes, expecting stronger effects. That is the wrong approach. The perineal area is sensitive. Aggressive pressure irritates tissue instead of helping it. Pain is not a good sign. Numbness is not a good sign either. Gentle stimulation matters far more than force. And another mistake causes many men to fail before they even start. They ignore relaxation. Stress blocks erections fast. A man might have normal blood flow and normal hormone levels, yet anxiety shuts the process down completely. Have you ever noticed how stress affects the body instantly? Heart rate changes, breathing changes, muscles tighten. The pelvic floor tightens too. That tension affects arousal and blood flow. This is why controlled breathing became part of these discussions online. Slow breathing helps the nervous system shift into a calmer state. That calmer state supports arousal better than panic and tension. Again, this is not magic. This is basic nervous system function. Now here is something many men never expect. Early erection changes sometimes appear years before heart disease symptoms. That is because blood vessels in the penis are smaller than blood vessels in the heart. Reduced circulation often shows up there first. So when erections weaken consistently, smart men pay attention early instead of hiding from the problem. That decision matters. The earlier doctors evaluate circulation, hormones, blood sugar, blood pressure, sleep quality, and medication effects, the easier treatment often becomes. Men who delay too long usually face more frustration later. And unfortunately, embarrassment keeps many men silent. They avoid doctors. They avoid conversations. They avoid testing. Then the condition slowly gets worse in the background. Now let me explain another detail most online videos skip completely. Not every erection problem starts in the penis. Some cases begin in the brain. Depression affects libido. Relationship stress affects arousal. Performance anxiety affects confidence. Poor sleep lowers energy and testosterone levels. Even constant stress from work changes hormone balance and nervous system response. That is why real treatment looks at the whole body. Not one trick, not one product, not one internet hack. Good medicine looks at patterns. Now pay attention to this next part. Men often confuse occasional erection difficulty with chronic erectile dysfunction. Those are not always the same thing. Doctors usually look for repeated symptoms over time before diagnosing erectile dysfunction. Some male patients only experience problems during stress. Others notice symptoms after starting new medication. Some notice changes after prostate surgery or diabetes complications. The cause matters because treatment changes based on the cause. That is why copying random online advice creates risk. And yes, hygiene matters too. If anyone tries any stimulation technique around sensitive areas, cleanliness matters. Rough objects, dirty tools, or aggressive methods increase irritation risk and infection risk. Simple and gentle always works better than extreme. Now think about this question honestly. Have your erections changed gradually over the last few years? Many men answer yes, but then they ignore the change because it happens slowly. Slow changes are easy to dismiss. That is dangerous. Your body rarely screams first. Usually, it whispers first. That whisper might look like reduced morning erections, lower firmness, lower stamina, reduced sensitivity, less confidence, longer recovery time. And many men over 60 experience these signs quietly before seeking help. The good news is this: early action often improves outcomes significantly. Lifestyle changes help circulation. Weight control helps hormone balance. Better sleep improves testosterone production. Exercise supports blood flow. Stress reduction improves nervous system response. And proper medical evaluation identifies hidden health conditions early. That is where smart men focus their attention. Not fake miracle promises, not exaggerated internet claims. In the next section, I'm going to show you where many men get this completely wrong, the advanced warning signs you should never ignore, and the safest medical approach doctors use first before recommending treatments. This is where many men get it wrong. They spend months searching for secret tricks online while ignoring the real warning signs their body keeps sending. And by the time many male patients finally see a doctor, the condition has already become harder to treat. So let's talk about the signs you should never ignore. Some symptoms start small, others become impossible to hide. You might notice erections losing firmness during intimacy. You might struggle to maintain an erection long enough for satisfaction. Some men notice weaker sensitivity. Others notice lower sexual desire completely. Some wake up and realize morning erections almost disappeared. That matters more than many men think. Morning erections often reflect blood flow and nerve function. When those disappear consistently, doctors pay attention. Now here is another sign many men ignore: fatigue. Low energy and erectile changes often appear together. Why? Because poor sleep, low testosterone, stress, obesity, diabetes, and circulation problems affect the whole body at once. And many men try to separate these problems when they are often connected. Have you noticed any of these signs? Pay attention to this next part. Some erection problems point toward more serious health conditions developing underneath. Diabetes damages blood vessels and nerves slowly over time. High blood pressure reduces healthy circulation. Smoking damages blood vessels. Excess alcohol affects nerve signals and hormone balance. Even sitting too long daily affects circulation in the pelvic area. That is why doctors do not treat erectile problems like a small issue. Sometimes, erections become the first warning sign of larger cardiovascular problems. And this is why delay becomes dangerous. The longer poor circulation continues, the harder recovery sometimes becomes later. That is the warning men need to hear. Not fear, not panic, awareness. Now let's clear up one major myth. Many men believe erectile dysfunction only happens because of aging. That is false. Healthy older men still maintain good erectile function. Age increases risk factors, but age alone does not automatically destroy sexual health. Lifestyle matters, medical conditions matter, mental health matters, sleep matters, activity levels matter, and early medical attention matters a lot. Now, here is another mistake many men make with the toothbrush technique. They expect instant, permanent results. That is not how the body works. Gentle stimulation around the perineum might temporarily increase awareness and blood flow response in some men. But if diabetes, severe artery disease, advanced nerve damage, medication side effects, or hormone problems exist underneath, no internet trick fixes those issues alone. That is why medical evaluation matters first. Wait, this is important. Pain during erections should never be ignored. Sudden curvature changes should never be ignored. Numbness should never be ignored. Complete erection loss appearing suddenly should never be ignored either. Those situations need proper medical attention, and men with uncontrolled diabetes, prostate surgery history, severe pelvic pain, nerve injury, or major heart disease should speak with a doctor before trying stimulation techniques around sensitive areas. Safety always comes first. Now, here is what helps most. Doctors usually start simple. First, they ask questions. When did symptoms begin? How often do they happen? Are morning erections still present? What medications are being used? How is sleep quality? How is stress? After that, basic testing often follows. Blood pressure, blood sugar, hormone levels, heart health evaluation, sometimes circulation testing, sometimes prostate evaluation, depending on symptoms and age. In my clinic, I see many men relax after this step because they finally understand what is causing the problem instead of guessing blindly. And once the cause becomes clearer, treatment becomes more effective. Now let's talk about treatment honestly. Some men improve through lifestyle changes alone. Weight loss improves circulation and testosterone balance. Walking daily improves blood flow. Better sleep improves hormone function. Stress reduction improves nervous system response. Stopping smoking improves vascular health. Reducing alcohol helps nerve and hormone function. These changes sound simple, but they work better than many men expect. Other male patients need medication support. Some need treatment for diabetes or blood pressure first. Others need hormone evaluation. Some benefit from pelvic floor therapy. And yes, doctors sometimes recommend erectile dysfunction medications when appropriate. But the goal is always the same: improve blood flow, support nerve function, reduce stress on the body, and identify hidden health conditions early. Now let's return briefly to the toothbrush discussion, because many viewers are waiting for this part. If a man chooses to try gentle perineal stimulation, keep these rules simple. Use only soft pressure. Never use aggressive motion. Never continue through pain. Keep the area clean. And understand this clearly: this is not a cure for erectile dysfunction. At best, some men report temporary stimulation effects linked to relaxation and nerve response. That is the realistic expectation, not miracle promises, not instant transformation. And honestly, many men get better results from improving sleep, exercise, stress, and circulation than from chasing strange internet methods. That truth matters. Now ask yourself this question honestly. How long have you been ignoring changes in your body? Months? Years? Many men wait because embarrassment controls them. But doctors discuss these problems every day. There is no shame in protecting your health. And early action often prevents worse problems later. Most men wait too long. That is the mistake. Watch for these signs. Act early. Pay attention to changes in erection quality, energy, circulation, and morning erections. Your body often warns you before bigger problems appear. This video is for educational purposes only and does not replace a consultation with a qualified doctor. If you want simple, clear medical guidance like this, subscribe and stay informed.